What's up, everybody, and welcome to this week's episode of the Wellman's Podcast. My name is Bryan Brozy. I'm joined by my friend and co-host, Keone Tita. Keone, how are you today?
Hey, Bryan. How is everybody out there today? Today, Bryan and I want to talk about a very common complaint that happens. I think most of us will experience headaches at least once in our life. If you haven't experienced one, it's really miserable and can be. So we want to just go through some information on headaches and what you can do to know whether the headache is really something you need to be seen right away for, or for most of us, it's really something that could be controlled with just natural, non-invasive remedies.
Okay, so finding out more of how important it is to get your headache checked out.
Right. And then what you can do about it and being safe about it from a natural perspective.
Perfect.
So anyway, so the types of headaches, let's just start there. There's many different types, and a primary care doc would diagnose them as either, usually of like five main types, but there's really, when you get down to it, many different types of headaches. But probably the most common headache there is probably a tension headache.
Mm-hmm.
And, basically this headache feels like a dull aching sensation all over your head. It's just tenderness and sensitivity around your neck. Usually I've seen it mostly with my clients, like in the back of their neck and head. A tension headache seems to come on most with, see it a lot in like students, see it a lot in people who read a lot where they're bent over, or drive a lot where they have tightness in their upper back. So you can almost think of it like a muscular tension, but it's tenderness or sensitivity around the neck. Can be in your scalp, shoulder muscles, forehead. It can come up, kind of a lot of times they'll migrate from the back of the neck all the way up over to the head into the forehead. So that's one. That's probably the most common one. And then the other one that we've all heard are migraine headaches.
Yeah.
And typically people describe this as like a pulsing sensation deep within their head that's just unbearable, that just doesn't seem to go away. Typically they'll can last anywhere from 4 hours to 72 hours. Wow. And some people can just be completely incapacitated with them. And they tend to be very sensitive to lights. They tend to be very sensitive to smells and to sounds. So a lot of people have these headaches just want to go into a dark room and just go to sleep, just get away from life until it goes away.
Yeah.
And what else? So another headache would be a type would be called what's cluster headaches. And typically these are a lot of times described as like a piercing pain, sometimes a burning pain, and they usually occur behind like one or both eyes, or one, usually on one side of the face, but it can occur on both. And you just, sometimes you get like swelling and flushing and redness, see in the face, some sweating. It just feels like for some I've had people describe to me as, there's this intense stabbing pain behind their eye where it just feels like somebody has an ice pick behind their eye or something. Mm-hmm. And they tend to be, the reason why they're called cluster headaches is they come in series, so to speak. So they'll tend to come in, you'll tend to get a flare up, and then it'll come soon after, and then you'll get another one, and then you may get a reprieve, and then it, happens again. So they're like kind of clustered together.
Okay, so more acute attacks with these.
Yeah, so. Yeah. And then probably, let's see, another one that I see a lot, and you see these in women primarily, are what are called hormonal headaches. So it really just has to go based on hormonal fluctuations. So some people get it around menses. Some people will get relief around menses. Some people will get it if they're on, certain types of birth control pills, or if they're pregnant, or anything that may have to do with hormonal fluctuations. So usually you can just call anything that's around menses, ovulation, anything like that would be called a hormonal headache. And then you probably heard of sinus headaches, right? With allergy season, so that's another one that comes up. And sinus headaches are, usually you feel intense, tenderness around the sinuses. Usually there's congestion with it. It may be the result of an allergic reaction. So pain with these are kind of focused in the sinus areas in the front of your head.
So those are the 5 types, or?
Yeah, those are the most common types that I see. But let me just mention some other ones that people can relate to. There's also caffeine headaches out there. So you hear people, that will say, yeah, if I do caffeine, I get a headache. And then you have other people say, oh man, if I do caffeine, it takes away my headache. Mm-hmm. You get a lot of these caffeine headaches are withdrawal headaches from coffee. Like people try to stop coffee, you'll get like this headache from doing it. Yeah. So a lot of times quitting cold turkey with if you're drink coffee a lot can bring on a headache. Other types are exertion headaches. So I see this one a lot in my gym. Especially people who aren't used to working out as intense and come in and overdo it, they can get an exertion headache, and it's just doing too much too fast. Really, in the gym, you see it. Or if you go outside for a run and haven't run in a while, a lot of times it can come on there. And then one of the main causes, well, not a main cause, but it is a significant cause, and it is one of those headaches that you really have to be careful with, is what's called a hypertension headache. So basically, high blood pressure can bring on a headache. Mm-hmm. So a lot of times when people come into my clinic, the first thing I'll do is check their blood pressure. Now, and just see if that's contributing.
Would the exertion headache be very similar to that, and that it's caused by basically a rise in blood pressure is giving you that pain?
Not necessarily. Okay. Not necessarily, because a lot of times it can be due to a number of things. But it's really interesting because a lot of times when people exercise intensely and they stop exercising, a lot of times their blood pressure will actually go really low.
Okay.
And so it may not necessarily be to the high blood pressure, but it can be. Sometimes it's due to subclinical dehydration, and mm-hmm. sometimes it can be due to lots of exertion out in the heat. Where the heat plays a big role, almost where you're starting to get heat stroke signs.
Right. Now, so you ran through all those types of headaches. What are some specific signs and symptoms that point you towards one type of headache?
The way they describe it, right? So mm-hmm. specifically, a tension headache, I just look for tender spots, in the back of the head, the neck, shoulders, temples, that type of thing. A migraine headache, I look for, are they having the auras? Are they lasting really long times? A lot of times they just come in and tell you. If it's related to their hormonal cycle, I'll designate it as a hormonal headache. If the blood pressure is high, always with their headaches, a hypertension headache. If they stop coffee, it's a caffeine headache. Mm-hmm. The cluster headache, they kind of come in, they're very painful, and they kind of come in series. So you can kind of flesh them out. And this is pretty, knowing what type of headache you have is pretty important for a primary care doctor, because, they may be treated slightly different. Okay. Mm-hmm. So, but with that being said, from a natural perspective, the remedies that we're going to go over today usually help with all of them. Okay. Will help with every single one of them. So we'll go through that. Another type of headache, which kind of speaks to the caffeine headache, is called a rebound headaches. And it's kind of like drug withdrawal, caffeine withdrawal, medication overuse. If you do too much meds, sometimes you get a headache, that type of thing. So, mm-hmm. so it's just knowing, what is maybe the cause of the headache, what are the signs and symptoms of the headache, and then you can kind of flesh out what it is.
Right. Yeah. Deal with
type
it
of
from
headache
there.
it is.
Yeah.
But as a healthcare provider, and you're going to need to know this too, is, if somebody comes into you that's never had a headache before, if you never had a headache and you get one, it's a headache. Your head is aching and it's awful.
Yeah.
It can be. And that's a bad sign when, if it's you never had a headache and then you get one. Okay. So that may clue a healthcare provider in that you really need to look into that and make sure that there's nothing serious going on. Okay. As opposed to somebody who always gets headaches, and they're going to come in, they're going to tell you what the headache's been diagnosed and everything else, and they know about it, and they'll just say, yeah, I get these all the time. I want to just see if there's something I can do besides popping NSAIDs or some headache medicines all the time. And the other sign that you really want to like pay more attention to this headache is if it's the worst headache of your life, right? So first and worst, those are two things to cue you in, not only as a layperson, but as a healthcare provider that, you really need to be careful and know what you're doing with these headaches, because headaches can it can be due to a stroke. It can be due to a space occupying lesion in the head, like brain cancer or something like that.
Right.
If the headache is not getting better, no matter what you do, then that needs to be looked at. So those are the main types of headaches. And of course it goes without saying, but I'll bring it up anyway, is there's also what we know as head injury headaches, right? So if you post-traumatic headaches, where if you had a head injury and ever since you've had that head injury you have a headache, these can usually last anywhere from 6 to 2 years after the head injury. And sometimes they just become absolutely chronic, where they're happening all the time.
Yeah. It sounds like for just the normal individual, you need to kind of monitor and take note of your headaches when you're having them, or what kind of things could be causing them. That'll help you get to the root of the problem. And if you need to refer out or go to a further specialist.
Right. But the purpose of the podcast today is really, what can you try before you actually go to the medicine cabinet and get your Aleve or your aspirin, your ibuprofen? What can you try? What can you do first before you do that? What can you do to reduce the the prescription meds for headaches? Because as you know, I mean, if you these things don't come without side effects, especially the longer that you've been on them. So what can you go through your checklist first and see what may help? So one of the first things I do is I will for headaches, I will just tell people, all right, well, did you drink enough water today?
Yeah.
I mean, so subclinical dehydration or outright clinical dehydration can bring on a headache. So sometimes just making sure that you're staying well hydrated throughout the day can not only help treat the headache, but definitely will help prevent them.
Yeah, and it works both ways. Too much or too little can give you the headache.
Right. That's a great point. Yeah. So if you're drowning yourself in water and drinking gallons of it, yeah, you can really cause a problem, electrolyte imbalance, and that can bring on an awful headache. But typically I tell people, if you're, 200 pounds or under, at most I would say maybe 100 ounces of water in a day. And I just mark that off as all fluids, typically, with the exception of sweet drinks and stuff. So unsweetened teas and things like that.
Okay. And a gallon is like 125, 126 fluid ounces, I'm pretty sure.
I don't know off the top of my head. Maybe you're right. Yeah,
I'm pretty sure.
Right.
I try and track what I'm drinking, so I feel fairly confident.
Okay. All right. So and also with the water intake, if you yesterday I did a crazy workout in this hot heat with some friends, and we basically ran like 2 miles, and we had the weights out there. I mean, I'm sweating like crazy. When you're working out intensely out in the heat, yes, you need to drink more water than usual, and you may want to think about also, like, in that gallon of water, like a pinch of salt. You shouldn't be able to taste salt, but something that has electrolytes in it, and it can help. But water is a simple thing to do.
Yeah.
But that can help. I mean, I can't tell you how many patients I've had over the years where that's all I told them to do, and it really helped their headache. The second thing that I will do is I will, just in case, I will make sure that their blood sugar levels stay stable, right? So sometimes blood sugar swings can bring on a headache. So, if they're going long periods of time without eating, and if they do that, they tend to get the shakes or they get headaches. And it's about maybe having more snacks in between the big meals and stuff, or having something on hand to just keep your blood sugar level stable. And that something on hand should really just be something that is higher in protein and fiber, isn't like just pure sugar. Unless it's an emergency situation and you're having a blood sugar crash. So
Mm-hmm.
that's where you'd want to do some type of candy or orange juice or something. But for most of us, it's just making sure that you're eating regularly and not eating big meals with lots of carb where you get huge blood sugar swings. So you want to try to eat balanced and have your macronutrients somewhat balanced, where you're getting protein and fiber in there. So, and one of the things I tell people, and I think we talked about this on a podcast before, is a good way to do that. If you're looking at the nutrition label of a processed food, and processed food, I'm talking about anything that comes in a can, wrapper, plastic bag, or anything like that. So like crackers, protein bars, all that stuff. Just take in that one serving, take the total number of carbs in grams minus the protein minus the fiber. And for a good blood sugar balancing meal or snack, that number should be 10 or less. So total carb minus protein minus fiber, that number should be 10 or less. And you just look at the nutrition label to get the totals off of there.
All right. So one more time: total carb minus the protein and the fat content.
And the fiber, not fat. Fiber. Yeah. Don't worry about the fat. So total protein minus fiber total carb minus protein minus fiber should be 10 or less.
Okay. But, protein, so fiber. Together.
Yes.
Subtract them.
Subtract them from the carbohydrate. Yes. One more time. Total carb minus protein minus fiber. 10 or less. That would be a good blood sugar controlling snack or meal. But just look at the nutrition label on your snack. And then the other thing that we do, and this kind of speaks to you, Bryan, with what you're doing, is one of the things that can bring on a headache that a lot of people just completely discount are biomechanical issues. Poor posture can bring it on, and that kind of speaks maybe to the tension headache, where you're bent over all the time reading a book or whatever. You're not exercising those back muscles. I mean, that tightness, that muscular tightness can come up from your traps all the way into the base of your skull, up and over into your forehead, and cause those tension headaches.
Yeah, we talked about it on the sitting episode, but I had a personal training client that was taking daily medications for headaches, and we got rid of those because it was biomechanically caused. And it's about kind of knowing what the problem is. And if you look up upper cross syndrome, that's typically where we see these tension headaches, because we know we have that where the vertebral artery comes up in the back behind the skull. There's a small little space where we have our suboccipital muscles, and when they're hypertrophying, or we're constantly like looking up, like we're looking at a computer or something like that, extending our cervical spine to look up, we narrow that space so that it can decrease the blood flow and cause those headaches. And that would be a perfect example of a tension headache. So if you look up upper cross syndrome, it's a common problem where you basically have tight pecs, weak rhomboids, tight suboccipital muscles, and weak cervical neck flexors. And that's common. So if you just address all those issues, lengthen the tightness or decrease the tightness of the tightness and strengthen the weakness, that should help alleviate those types of headaches. Yeah.
So those are three things that people can do, without seeing anybody really, and really that's, again, the poor posture biomechanical issues, you should see a PT or somebody, a chiropractor, somebody who's trained in that if your exercise regimen is not taking care of it. A lot of times just exercising your whole body will take care of that, but a lot of people don't. But that's a simple thing to do. So to address that, I would say, hey, try exercising those muscles regularly.
Yeah,
a lot of times when you do big body movements, you can with your workouts.
Yeah, a huge ratio that I like that goes along with this. It's just a 3-to-1 ratio for your back. So you should be training your back muscles and the things that pull towards you 3 times more than you should be training anything that you push. So like a chest press, shoulder press, anything like that you want to do. 3 times the pulling than you want to do the pushing in your workouts as far as your back and your upper
and
back
that's
goes.
interesting. Yeah, that's interesting because a lot of us, I mean, especially when I was coming up in high school, college, is all about the chest and
yeah, it's all about the beach.
it's all about the beach. Yeah,
yeah,
and it's interesting because you're right. I mean, you get overdeveloped pecs and you're not really focused on your back. You know, it can be an issue.
Yeah.
So number 4, as far as like addressing this headache issue, is looking for certain sensitivities, and specifically, you know, I'll look for food sensitivities, and one of the headaches I did not mention is a what's called a histamine headache, and any foods that are high in histamines can bring on a histamine headache. And basically, you have a food sensitivity to foods that are high in histamine. So foods that are high in histamines are fermented foods, smoked foods, you know, aged cheeses, like the hard cheeses tend to be very high. What else? Smoked salmon. There's a number, but you can type in, actually online, look up histamine-free diets, and you'll find all the lists of foods that contain lots and lots of histamines. But it is interesting that one treatment for having too much histamines is making sure you're drinking enough water, because water acts like a mild antihistamine. But histamines can be an issue for a lot of people, and there are certain things that you can do that can address that naturally with like enzymes and, you know, drinking water or
decreasing the amount you intake.
Decreasing the amount you intake, and then some people have gut integrity issues that may need to be addressed that can help that. But for any type of food sensitivity, so you've probably heard about people, oh man, every time I drink red wine I get a headache, right? It may be a sulfite sensitivity thing, or every time I drink a certain alcohol I get a headache. Every time I eat this I get a headache. Chocolate may bring it on. So a lot of people will know how, you know, what that is. But sometimes you need testing to test that and see.
If you're getting a headache with eating chocolate, that's a curse. That's not an allergy.
For me, yeah, it's not worth living anymore. I mean, it's like, you gotta gotta address this quickly, and if we can't take care of it, I'm out of here. But it's really awful. I mean, I see people that come in, I can't eat chocolate. I'm like, what? Oh my God, that's like the worst thing. So your hell is here, not eating chocolate, huh? So, but yeah, that's a big one for some people.
Wow.
And then from a natural perspective, those are all kind of lifestyle things, but from a natural perspective, you know, we talk about this a lot. Can you guess what I tell people to take if they as far as a supplement, if they're having a headache?
It's got to be on the periodic table.
It's on the periodic table.
Is it magnesium?
It's definitely magnesium. Yes, magnesium by far can address almost all of those headaches that we listed at the beginning. And you know, magnesium is one of those minerals that we talked about it before, but it's one of those minerals that most people, I think the estimates by the World Health Organization is that 3/4 of Americans don't meet the recommended daily intake of magnesium. And magnesium does so much in your body, it's unreal. It's like over, 300 biochemical reactions that require magnesium to do things. Anyway, magnesium, as you can tell, is like, you know, my cure-all. We bring it up all the times on these podcasts. It's very cheap. It's very safe for the most part. Most people can take magnesium. Probably the worst thing it's going to do to you if you take too much is give you a laxative effect, which a lot of people need. And there are certain forms of magnesium that are better absorbed. But one of the reasons why we are subclinically deficient in magnesium, and I say subclinical because most of us could go to a doctor and they would test our blood magnesium and it would look okay. But we don't really know what's going on in the cell. So subclinical magnesium deficiency is you know, an epidemic out there. But one of the reasons why we get it is because we don't eat our greens, right? Green vegetables, and right in the middle of that chlorophyll molecule lies magnesium. So eat your vegetables. Yeah.
Episode 30 for more magnesium fun.
Yes, so magnesium's a big one. And then another really good natural treatment that has, you know, both magnesium has good science behind it, and then certain B vitamins have a lot of good science behind them as far as treatment. So riboflavin, vitamin B2 is a big one. So you'll see a lot of natural migraine remedies that have B2 in it. I think all the B vitamins can help. So I usually will recommend just a good B complex vitamin that has all the B's in it: B1, B2, B6, B12. Like B6, B1, all of those vitamins can if you're not getting enough in there, it can bring on a headache. But if you get enough in there, it will help prevent and treat.
So you can do these acutely. I know obviously if you like swallow a bunch of magnesium tablets while you have a headache, it's going to take a minute before you actually feel it, relieved. But all of these things you're mentioning, you could suggest someone do with an acute headache.
Yes. Well, yes, you can. But I would say everything that we mentioned, I would say with the exception of water and possibly B2, all of them would be more preventive than treatment, although they're both. Like, I would not expect somebody who has a raging migraine headache to take magnesium, right when they're getting it, and then expect it to be gone within minutes after taking it. Right. I just haven't experienced that. But what I have experienced is people who take it regularly don't get them as much anymore.
Okay. Right. Okay. And then you mentioned B2 out of context. Why is B2
just because there's quite a bit of neat research on that. I think that's probably the most researched B vitamin for headaches. Okay. And I've actually had some experience where people take their B vitamins, and usually it's the B2 that they're taking that it seemed to take the headache away. Okay. But again, these are more preventive things. Another thing that has some decent research on it is taking CoQ10 for headaches. Again, I would say it's more of a preventive. I wouldn't expect you to take it and be able to get rid of your headache right away. Right. Now, one thing there are a few things that may get your headache taken right away that's natural, and one of the things are certain essential oils seem to be pretty good at that. So especially if you're having like a tension headache or sometimes even a migraine headache, lavender oil or peppermint oil, maybe rubbing it on your temples. Sometimes that can help. Just the smell of it can help reduce the headache, and for some people it can take the pain and discomfort right away almost immediately, and that's a really simple thing to try. Yeah. And then, I use them a little bit in my clinic, two herbs. One is feverfew, and that's a plant an herbal plant that has, some pretty good anti-inflammatory properties and has some research on it as far as helping to reduce the headache frequency. And for some people, I've heard in my clinic that taking it seems to take the headache away and may help acutely. Again, I still think it's more of a preventive. And then the other one is another herb called Butterbur, and it's quite a bit of research, if I'm not mistaken, in Germany. In fact, that's where the plant is native to, and it seems to reduce headache symptoms in both adults and children. So there's an acute, herbal thing that you can do. Butterbur, just all the products in the United States have been, for the most part, I think, purified if they're being sold on the shelf. But there are some compounds in there that need to be taken out that can be harmful. So you just need to make sure you get a purified form, standardized Butterbur supplement. If
someone is starting to take Butterbur or any of these herbs for preventative measures for their headaches, at this point, are you telling that individual they definitely need to go see some sort of physician to get this more looked at, or is this where are we in the continuum of?
Well, it depends on them, right? So if they've come into me and they've had headaches for years and years and years, and they've been on naproxen or Imitrex or some of the other headache medicines, and they want to come off of them, then I would start with my list that we've already talked about, natural treatments, and if they want something on hand to help them possibly acutely, I may recommend feverfew or Butterbur on top of the magnesium and maybe B vitamins. And in fact, a lot of natural headache remedies will have all of those in one thing.
Okay.
But if they come into me and they're like, I never had a headache that felt like this. I feel like my head's going to explode, and or this is the worst headache I ever had, or it's the first headache I ever had. What I may do for them is go to some more high-powered stuff, like more of the over-the-counter stuff, and see if we can take away the pain. Because I'm not into people trying some natural stuff and just just because it's natural and they're in excruciating pain. Like take something a little bit more powerful that may take it away, and then we can think about doing some preventive measures. And if they don't get any relief from that, so if they come into me and said, I've tried some over-the-counter stuff and it seems to be getting worse, I'm referring them out right away.
Okay.
I may even, depending on the situation, refer them right to the ER based on that.
Yeah.
And that's a rare, that's really rare. I mean,
absolutely.
It's all situational with what's going on with them. So you take a good history, and then you can pretty much determine what you need to do with that. One thing that I do is that can help headaches acutely and also preventive is acupuncture, right? So I can't tell you how many people I've treated with acupuncture with headaches. And that by itself is a great standalone treatment, especially if it's just, they're getting headaches all the time and you rule everything else out.
So where are you usually inserting the needle here? Because I know in the traditional Chinese medicine podcast we talked about how sometimes it's not necessarily where your pain is or where the situation is on the person. So where are you doing these?
So typically you take the history of the person and you treat the whole person. So a lot of the points are going to be on places that may not be known as points that have anything to do with headaches. All right. But that kind of potentiates the treatment. But the typical headache points are there's 2 points. There's one that's called LI4 or Hagu. And that point is located between your index finger and your thumb in the muscular part there. Right. So between your index finger and your thumb, it's kind of in that web part where it's really, really fleshy. And if you press that point, you'll feel like, take your thumb and rub in that, you'll feel like a mild sensation there, that crampy sensation. And that's the exact point where you want to put that needle. And that's a stereotypical headache point. And the other headache point that's really good are the temple areas. And that point is called Tai Yang. That's the Chinese name for it. And it's just the temple area. And it's interesting. You'll notice a lot of people have headaches. They'll rub those points without even knowing, that they're treating their headache. They'll use acupressure on it without even knowing it. And same with their hands. Another headache point is also the point that is like at the root of your nose, kind of like right there where your brow hits the root of your nose, and they'll rub that area too. And that point is known as the urinary bladder 2, or it's close to that. And then there's another point that's right between the eyes called yin tongue, and that's another headache point. So typically I'll treat all those points, and a lot of times you can just rub those points and it can help the headache acutely. So you don't necessarily need to see an acupuncturist, but sometimes those points can just be rubbed, and just for a few seconds or so, and then you can pretty much like take the edge off a lot of times just doing that.
Wow.
Yeah. The other thing I do with people is a lot of people don't really know what's going on with their headaches. They may say, every time I go into this certain building, I get a headache, or I go to this certain place, I get a headache. It may be due to the certain smells in there. It could be due to mold. These are all like, allergic, sensitivity type things. So it's a lot of times strong smells bring on a headache. So it's just trying to stay away from that. But one of the things you brought up was how do you know, like, really when to refer out? And to me, and maybe it's just because I've been in medicine so long, it just starts becoming common sense, right? So some serious things like meningitis can bring on a severe headache. Usually you have a really bad stiff neck. sometimes, if you have a bad headache and you have confusion and you're slurring your speech or vomiting, or you have any fever that's, for an adult that's like over 100 degrees Fahrenheit, that's a referral. If you have any paralysis or vision loss, that's a referral, and I've had that before where people have come in with that. But I just tell people, like, any weird symptoms, first or worst headaches requires referral. Just go with that, or get some other treatment.
Mm-hmm.
But so those are my main natural treatments. But what about the, just real quick before we end, some of the things that treat headaches are, and we mentioned a bunch of them, are like, for tension headaches, aspirin, ibuprofen, naproxen, ibuprofen being Advil, naproxen being Aleve, acetaminophen, and caffeine, like Excedrin, tension headache. This is stuff you can get over the counter. If those don't work, there's indomethacin and meloxicam, something known as Mobic. Those things are pretty common headache medications. They're kind of like another tier of treatment,
Okay.
Sumatriptan or Imitrex is a pretty big headache medicine. And if I'm not mistaken, I think there's a study a while back that compared, is either Magnesium and Butterbur, and those did just as well as the Imitrex, which is pretty amazing, considered Imitrex as a prescription. And sometimes just doing a lidocaine, like a local anesthetic, can help people wherever that headache is going. And Topamax is another med that's used. There's some indication this is more of a natural remedy, but melatonin may help. Steroids can help, and this all kind of depends on the headache that you're dealing with, on what you're gonna use,
right,
to treat it. What else? Sometimes like preventative medications, like Inderal or propranolol can help. I've seen that. Topamax, amitriptyline. A lot of these things you'll see. For sinus headaches, you see like Zyrtec, allergies type stuff, citrusine, Sudafed. A lot of these will treat that, or at least take some pressure away. But again, you want to try to avoid that stuff as you can, and you certainly don't want to have to be dependent on it. You want to be dependent on more of the natural stuff.
Yeah, absolutely. So prevent it with everything you mentioned: the magnesium, the healthy water intake, the B vitamins, et cetera,
blood sugar control. Look at food sensitivities. Maybe a high histamine diet is to blame. If you're going to take something, reach for the magnesium, a glass of water. Make sure you're not eating high carbohydrate meals or really sweet meals. Think about taking B vitamins, and you're probably going to be pretty safe. As long as you're looking at the dose on the bottle of what you're getting at, like a local health food store, taking some feverfew or Butterbur. But it's really best to see a physician, like an naturopathic physician or holistically minded physician, to tell you the right dosing of all that stuff. Because a lot of times people will get this stuff and they don't dose it right, or it's just really not a good product.
Mm-hmm.
That they're using. So they think, oh, I've tried feverfew, but it's just a product that
right.
You have no idea what the quality is, and it may not be that it's not working. It may be that you really don't have a whole lot of feverfew in there in the first place.
Yeah, so. Absolutely. And then with we'll call it just everyday headache, your acute little headache, do these pressure points, increase your water intake, or maybe decrease your water intake depending on the situation that you were just previously in.
Yep.
Maybe use some of those essential oils to combat it. And what were some of the other things? We did that pressure point, the essential oils.
Yeah, so the pressure point, essential oils, blood sugar control, making sure that that's not out of whack. For hormonal headaches, if you know that they're hormonal headaches, a lot of people go, well, what are you going to do about that? Actually, magnesium may really help significantly with that. Magnesium actually indirectly affects a lot of hormones. Like you said before, Brian, though, it's probably not going to take it right away immediately, but man, it will certainly help them prevent them from coming on.
Right.
So that's pretty much it. But again, let's just reiterate, first or worst headache that you ever had, that requires somebody to immediately look at that and see what's going on there. Making sure your blood pressure is under control. We did a podcast on high blood pressure. That's so important. If it's too high, a lot of times the first symptom you get before having a stroke is a headache.
Mm-hmm.
So getting that down. So it's always good to monitor your blood pressure and always, have your doctor or physician or healthcare provider take it if you know that you have issues with it. And as we know from our previous talk about magnesium is one of those things that probably can't bring down blood pressure acutely, but it certainly will bring it down over time if you take magnesium on a regular basis.
Yeah. So listen to your signs and symptoms, and that'll really tell you a lot about your headache.
Yep.
Awesome. Thank you for listening, everybody.
Yep.
Thank you, Keone. We will talk to everyone next week.
All right. Take care, everybody. Thanks. Bye.